Hi, I'm Liz Perez, and I'm going to be discussing a psychotropic or antipsychotic medication that has actually been around since the early 1950s. Thorazine, which is also known as chlorpromazine, made it possible for many living with mental disorders to gain independence and the ability to control a lot of unwanted behaviors. This was a really exciting discovery because in many of these cases, patients improved so much that other therapies ended up becoming more effective, ultimately leading to them no longer requiring hospitalization. In the next several slides, I will share some additional information about Thorazine with you. I'm going to share its drug classification, the drug class that this medication specifically belongs to, its mechanism of action. I'll show you some of the common dosage amounts that this medication is available in, and of course some of the side effects associated with it. Last but not least, I will also share some of the nursing implications or considerations to keep in mind. This will all be very important as we provide care for many different patients who oftentimes may be receiving this type of medical treatment. Okay, so Thorazine or chlorpromazine belongs to a drug class known as phenothiazine antipsychotics. This is a first-generation typical psychiatric medication that's used to treat certain mental or mood disorders such as schizophrenia and manic phase of bipolar disorder. It's used to treat positive symptoms of schizophrenia such as hallucinations, delusions, and suspiciousness. It also helps with thinking clearer and can also reduce aggressive behavior or one's desire to maybe hurt themselves or others. Okay, mechanism of action. So Thorazine works by acting on the CNS to prevent overproduction of the neurochemical dopamine. It blocks receptor sites for dopamine, leading to a reduction of the effects of dopamine in regions of the brain. Remember, an overproduction of dopamine actually leads to psychotic behavior. Additionally, this medication is also used to control nausea and vomiting. It is used to relieve prolonged hiccups. It's used to relieve restlessness or anxiety related to the thought of an upcoming surgery, and can also help treat tetanus. Okay, so now we're moving on to nursing implications or considerations. So one of the biggest things here is patient education. This is huge. So it's really important that patients have a clear understanding that Thorazine is a very strong medication. So it's important to remind patients the importance of remembering to avoid consuming alcohol. Any over-the-counter medications or supplements should definitely not be taken until they've consulted their physician, their healthcare provider. Additionally, remembering to remind the patient that these medications can oftentimes cause stomach upset, so make sure they know that they should really take this medication with food or milk. Additionally, if this medication is ordered once daily, make sure patients are aware of the importance of taking this medication 1 to 2 hours before going to bed. This always definitely will help promote sleep. Additionally, any antacids, of course, will affect the absorption of any antipsychotics. So remember to encourage your patient or remind your patient the importance of knowing that it's best for them to take this medication either 1 to 2 hours after oral administration of any antipsychotics. Additionally, the biggest one, of course, is remembering that antipsychotic medication or many medications should never be discontinued without consulting their physician first. A few other things, of course, making sure patients are aware that they need to keep an eye on whether or not they're noticing any abnormal involuntary movement. This is referred to as AIM. A lot of times this can actually be a sign of tardive dyskinesia, so we want to keep a close eye on that as well. Also reminding patients to observe for any signs of EPS, which is what we discussed in a slide earlier. Just educate patients and their families. Remember to also remind them not to be exposed to a lot of sun. When they're out in the sun, encourage them to wear a wide-brimmed hat or cover all exposed skin. Use sunscreen when they're out in the sun. Taking these precautions can actually help lessen the patient from suffering any sunburn, especially if the patient is on this specific medication.